Hi, this is Mark Besser of Besser Healthcare. In this video, I will discuss syphilis and its symptoms, stages, transmission, risk factors, diagnosis, treatment, and prevention, and our recommendation on how and where you can get tested. Either you want to know for sure if you are syphilis-free, or if you think you have syphilis, with fast, affordable, and 100% discreet, private, and confidential testing. What is syphilis? Syphilis is a sexually transmitted infection caused by the bacterium Treponema pallidum. It is easily curable with antibiotics. However, without proper treatment, syphilis can cause serious and permanent problems like brain damage, paralysis, and blindness. The only way to know if you have syphilis is to get tested. What are syphilis symptoms? Syphilis develops in stages, and each stage may come with different symptoms. However, syphilis can be confusing and sneaky. Stages may overlap or may not always happen in the same order. Sores caused by syphilis may be hidden, since they can appear in hard-to-see areas. Syphilis can also go through periods when there are no symptoms for years. Even when signs are apparent, syphilis may still be overlooked. Syphilis has been called the great pretender because its symptoms in men and women can seem like many other diseases. At any stage, syphilis can spread and cause damage to the brain and nervous system called neurosyphilis, and the eye called ocular syphilis. Primary syphilis. The first sign of syphilis is usually a small painless sore called a chancre. It appears at the spot bacteria entered your body, often on, around, or inside the genitals or anus or rectum, and sometimes on the lips or mouth. And it's usually single, but may be multiple. Chancres usually develop within 3 weeks of infection, although symptoms may appear from 10 to 90 days after infection. Because a chancre is usually painless and may be hidden inside the vagina or rectum, a person may not even know they have primary stage syphilis. Chancres heal on their own within 3 to 6 weeks. Even when a chancre disappears, the syphilis bacteria are still in the body unless a person receives treatment. Secondary syphilis. While a chancre is healing or several weeks after it has healed, a person with syphilis may progress to the secondary stage. Secondary syphilis symptoms include skin rashes, which usually are not itchy, lesions in the mouth, vagina, or anus, fever, swollen glands in neck, groin, or armpits, weight loss, hair loss, sore throat, headache, muscle ache, fatigue. Symptoms will go away whether you get treatment or not. They may come back later or not return at all. But without the right treatment, syphilis stays in the body, and the infection can progress to the latent or even tertiary stage of syphilis. Latent syphilis. Latent syphilis symptoms include no symptoms even for years. Although latent syphilis is silent with no visible signs or symptoms of syphilis present, the infection isn't gone. During the early part of the latent stage, a person is contagious, even when no signs are present. Tertiary syphilis. Many people with untreated syphilis don't develop tertiary syphilis. However, when it happens, it's very destructive. Tertiary syphilis can impact many different organ systems and cause serious problems and even death. Tertiary syphilis symptoms may include large sores called gumata, which appear inside the body or on the skin, strokes, numbness, deep, boring bone pain, heart problems, vision problems, or blindness. While syphilis can be treated at any stage, treatment does not reverse the damage that has already been done. How do you get syphilis? Syphilis is most commonly spread through skin-to-skin or mucous membrane contact with someone's syphilitic sore, also known as a chancre. This contact most commonly happens during vaginal, anal, and oral sex or sexual contact. Syphilis is contagious during its primary and secondary stages, and it can sometimes be spread during the early latent period when symptoms stop showing. Syphilis can also be transmitted from pregnant women to their baby, which is called congenital syphilis or CS. Congenital syphilis can be dangerous. The Centers for Disease Control and Prevention, or CDC, reports that up to 40% of babies born to women with untreated syphilis may be stillborn or die from the infection as a newborn. Who is at risk of syphilis? Anybody who is sexually active can get syphilis during vaginal, anal, or oral sex. You may have an increased risk of getting syphilis if you have unprotected sex, have partner or partners who have tested positive for syphilis, have multiple sex partners, are a man who has sex with men or a mesum, have HIV. The CDC also recommends all pregnant women get tested for syphilis during their first prenatal visit. Is syphilis curable? Yes. Syphilis is easily curable with prescription antibiotics. When caught in the early stages, syphilis is simple to cure with a single injection of penicillin. Depending on how long you have had syphilis or how the infection has progressed, the amount and type of treatment may vary. Treatment kills the syphilis bacteria, but it does not repair the damage that's been done. How do you prevent syphilis? The best way to prevent syphilis is to not have sex, but having safer sex helps reduce your risk. Using a latex condom or dental dam every time you have sex provides a barrier against direct contact with a sore. However, sometimes sores pop up in areas that aren't covered, and contact with these sores can spread syphilis. Limiting your sexual partners or having a mutually monogamous relationship with a sex partner who has tested negative for syphilis can help you prevent infection. If you think you or your sexual partner or partners have syphilis, get tested. Regular STD testing keeps you informed about your sexual health status and empowers early detection and treatment. And now, onto our recommended syphilis and other STDs screening company. Click the website link listed in the description below this video to see the list of their test centers in your area with the discount coupon. Or go to bessercare.com/STDcheck. Our recommended syphilis and other STDs screening company makes getting tested for STDs a simple and convenient process in just 3 steps. Step 1. Order their STD 10 test panel or individual tests online or by phone. Step 2. Choose one of their 4,500 test centers nationwide. Testing only takes minutes. Step 3. Your test results are delivered in your online account within 1 to 2 days. The entire process is fast, affordable, and 100% discreet, private, and confidential. Remember, either you want to know for sure if you are syphilis-free, or if you think you have syphilis, you need to get tested as soon as possible. Don't delay. Thanks for watching this video. If you like this video or find value from it, please click the like button and let us know what you think in the comments section below. Or if you have further questions or want to share something with us in private, please feel free to reach out to us at mark@besserhealthcare.com. And if you want us to include a certain topic in our next videos, please let us know in the comments section below or email us. Also, subscribe to our channel and click that bell for you to be notified of our upcoming videos. See you again in our next videos. Stay safe and healthy, everyone.